Welcome back to the channel. If you're new here, every week we break down simple, science-supported health strategies designed specifically for those of us over 60. No gimmicks, no overpriced supplements with labels you need a magnifying glass to read, just honest, practical information you can actually use. Today we're talking about your pancreas, that quiet little organ tucked behind your stomach that most people never think about until something goes wrong. And we're talking about a drink so cheap, so shockingly simple, that when I tell you what it is, you might laugh. You might even feel a little annoyed that nobody told you sooner. Here's why this matters right now, especially if you're over 60. After the age of 55, your pancreas begins to slow down. The beta cells, those are the tiny factories inside your pancreas that produce insulin. They get tired. They become less efficient. They start misfiring, like an old car engine that sputters on cold mornings. The result? Your blood sugar creeps up. Maybe not dramatically. Maybe just enough that your doctor furrows her brow during your annual checkup and says something like, "We should keep an eye on this." Sound familiar? You are far from alone. More than 48% of Americans over the age of 65 have prediabetes, nearly half, and most of them have no idea because they feel fine until they don't. So today, I'm going to show you exactly what this drink is, why it works, what the research says, and how to do a simple 7-day challenge that could give you noticeable results before the week is over. No prescriptions, no expensive juicers, nothing weird, just something your grandmother probably already knew. Let's get into it. All right, the drink is cinnamon tea. Now hold on. Before you roll your eyes or click away, give me 60 seconds to explain why this isn't just another internet folk remedy. Because the science behind cinnamon and pancreatic function is surprisingly robust, and it's been studied for over 2 decades. Cinnamon, specifically Ceylon cinnamon, which is sometimes called true cinnamon, contains a compound called cinnamaldehyde. That's the substance that gives cinnamon its warm, slightly spicy smell. When cinnamaldehyde enters your bloodstream, it does something remarkable. It mimics insulin. Not perfectly, not like a pharmaceutical drug, but enough that your cells begin opening up and absorbing glucose from your blood more willingly. Think of your cells like little doors. Over time, especially as we age, those doors get stiff. They don't open as easily when insulin comes knocking. Cinnamaldehyde is like spraying a little oil on the hinges. A 2003 study published in Diabetes Care, one of the most respected journals in the field, found that consuming between 1 and 6 grams of cinnamon daily reduced fasting blood glucose levels by 18 to 29% in type 2 diabetic patients over a 40-day period. 18 to 29% from a spice that costs roughly $3 a jar. A more recent meta-analysis from 2019, reviewing data from 16 randomized controlled trials and over 1,000 participants, confirmed that cinnamon supplementation significantly lowered fasting blood glucose and improved something called HOMA-IR, which is a measurement of how resistant your body has become to its own insulin. Now here's the part that specifically matters for your pancreas. When your cells respond better to insulin, when those little doors start opening more smoothly, your pancreas doesn't have to work as hard. It doesn't have to churn out extra insulin to compensate for the resistance. That reduced workload allows your beta cells to recover, to rest, to function more like they did 10 or 15 years ago. And the delivery method, warm tea, matters too. Warm liquids increase gastric motility, which means your digestive system moves things along more efficiently. Drinking cinnamon steeped in hot water allows the active compounds to dissolve and absorb faster than simply sprinkling powder on toast. So how do you make it? Dead simple. Take 1 Ceylon cinnamon stick, or half a teaspoon of Ceylon cinnamon powder, and steep it in 8 ounces of hot water for 10 minutes. That's it. No sugar, no honey. If the taste feels too plain, a small squeeze of fresh lemon is perfectly fine. Lemon actually adds its own modest blood sugar benefit through its polyphenol content. One important note: make sure you're using Ceylon cinnamon, not cassia cinnamon. Cassia is the more common variety found in most grocery stores in the United States. It's cheaper, darker in color, and contains significantly higher levels of a compound called coumarin, which can stress your liver if consumed daily over long periods. Ceylon cinnamon is lighter in color, more delicate, slightly sweeter, and contains only trace amounts of coumarin. You can find it at most health food stores or online for around $6 to $8 for a bag that'll last you months. Let me take a moment to explain why your pancreas specifically deserves your attention at this stage of life, because most people focus on their heart, their joints, maybe their brain, and they completely overlook this organ until a serious diagnosis forces them to pay attention. Your pancreas has two major jobs. First, it produces digestive enzymes that break down fats, proteins, and carbohydrates from the food you eat. Second, it produces insulin and another hormone called glucagon, which together keep your blood sugar balanced throughout the day, after meals, between meals, while you sleep. After the age of 60, several things happen simultaneously. 1. Your beta cell mass decreases. You physically have fewer insulin-producing cells than you did at 40. 2. Chronic low-grade inflammation, which is incredibly common in older adults due to years of accumulated metabolic stress, processed food consumption, and sometimes medication side effects, slowly damages the pancreatic tissue. 3. Fat deposits can begin accumulating in and around the pancreas, a condition researchers call pancreatic steatosis. That fat interferes with the organ's ability to do its job properly. The combined effect of all three factors is that your pancreas is quietly struggling, and the earliest sign, long before a diabetes diagnosis, is postprandial hyperglycemia, a fancy term that simply means your blood sugar spikes higher than it should after eating and takes longer to come back down. You might notice it as fatigue after lunch, that heavy, sluggish, I need to sit down feeling 45 minutes after a meal, or brain fog in the afternoon, or waking up at 3 in the morning for no obvious reason, which can actually be triggered by a cortisol spike your body releases when blood sugar drops too low during the night. Many seniors ignore these signs completely. They chalk it up to aging. Of course I'm tired after lunch. I'm 72. But tiredness after eating is not an inevitable consequence of age. It's a signal. Your pancreas is waving a small flag, trying to get your attention. And that's where this 7-day cinnamon tea challenge comes in. It's not a cure. It's not a replacement for medication if your doctor has prescribed something. But it is a gentle, evidence-supported way to give your pancreas a little breathing room and potentially see measurable improvement in how you feel day to day. Here's how the challenge works. 7 days, 1 simple drink each morning, a few small supporting habits layered in as the week progresses. Nothing extreme. Nothing that requires equipment or willpower you don't have. Just small stacking changes that compound on each other. Day 1. The baseline cup. On day 1, you simply make and drink 1 cup of Ceylon cinnamon tea first thing in the morning before eating breakfast. This is important. Drinking it on an empty stomach allows the cinnamaldehyde to interact with your digestive lining without competing with food for absorption. Steep 1 cinnamon stick or half a teaspoon of powder in hot water for a full 10 minutes. Sip it slowly. Notice the flavor. That warm, almost woodsy sweetness settling across your tongue. Let your body wake up to it. If you have a home glucose monitor, take a fasting blood sugar reading before you drink the tea. Write it down. This is your baseline. You're going to compare it at the end of the week. Day 2. Add the walk. Day 2, same tea, same routine. But today, after you finish your tea and eat breakfast, take a 10-minute walk. Not a jog, not a power walk, a stroll, around the block, down the driveway and back, through the living room if the weather's bad. 10 minutes of gentle movement after eating has been shown in a 2022 study published in Sports Medicine to reduce postprandial blood sugar spikes by up to 27%. Your muscles, when they're moving, actively pull glucose out of your blood to use as fuel. No extra insulin required. So you're helping your pancreas from 2 angles now, the cinnamon improving cell sensitivity and the walk reducing demand. Day 3, the evening cup. On day 3, you add a 2nd cup of cinnamon tea in the evening, roughly 30 minutes before dinner. Research suggests that pre-meal cinnamon consumption may blunt the glycemic response to whatever you eat next. So that plate of pasta or that serving of rice your body usually struggles to process. The cinnamon gives your system a head start. You're essentially priming the pump. 2 cups a day, morning and evening, bookending your meals. Day 4, the sugar audit. Day 4 is where things get interesting. Same 2 cups of tea, same post-breakfast walk. But today, open your pantry and refrigerator and read the labels on 5 items you eat regularly. Look specifically at added sugars. Not total carbohydrates, added sugars. You might be stunned. A single serving of flavored yogurt can contain 19 grams of added sugar. A bottle of barbecue sauce, 12 grams per tablespoon. Certain breads that look perfectly healthy and wholesome, pack in 4 or 5 grams per slice. You don't need to throw anything away. You don't need to go on a diet. Just notice. Awareness alone tends to shift behavior naturally, without the stress of rigid rules. Day 5, hydration focus. Day 5, layers in hydration. Most adults over 60 are mildly dehydrated without realizing it because the thirst signal weakens with age. Dehydration concentrates your blood, which artificially raises blood sugar readings and forces your pancreas to release more insulin to manage the same amount of glucose. Today, in addition to your 2 cups of cinnamon tea, aim to drink at least 4 additional glasses of plain water spread throughout the day. Keep a glass on the counter where you'll see it. Every time you walk past, take 3 sips. By the end of the day, you'll have consumed more water than you probably have in weeks. Day 6, the breathing reset. This one surprises people. On day 6, add a 2-minute breathing exercise before your morning tea. Sit comfortably. Inhale slowly through your nose for 4 counts. Hold gently for 4 counts. Exhale through your mouth for 6 counts. Repeat 5 times. That's less than 2 minutes. Why does breathing matter for blood sugar? Cortisol. When you're stressed, even the low-level, barely conscious stress of daily worry, medical bills, news headlines, family tension, your adrenal glands release cortisol. Cortisol tells your liver to dump stored glucose into your bloodstream as an emergency energy source, regardless of whether you need it. Your pancreas then scrambles to produce insulin to manage that unnecessary glucose flood. Chronic stress literally exhausts your pancreas. Controlled breathing activates your parasympathetic nervous system, lowers cortisol output, and gives your pancreas a genuine physiological break. If you're over 60, or if you're caring for an elderly loved one, this information could genuinely be life-saving, not in a dramatic, cinematic way, but in the quiet, cumulative way that small daily habits either build health or slowly erode it. Please consider sharing this video with someone you love. It might be the nudge they need. Day 7. Measure and reflect. Final day. Same morning tea, same breathing exercise, same walk after breakfast, evening cup before dinner. But today, if you have that glucose monitor, take another fasting reading before your tea. Compare it to day 1. Now, individual results vary. Genetics, medications, diet, sleep quality, existing conditions all play a role. Some people see a noticeable drop in 3 to 5 points. Others feel the difference before they see it in numbers. Less afternoon fatigue, fewer sugar cravings, more stable energy between meals, sleeping through the night without that mysterious 3 a.m. wake-up. The point of this 7-day challenge isn't to produce a miracle. The point is to demonstrate to yourself that tiny, nearly effortless changes, a cup of tea, a short walk, a few deep breaths, actually register in your body. They matter. And if 7 days can produce even a subtle shift, imagine what 60 days could do, or 6 months. Before we wrap up, let me address a few mistakes people commonly make with cinnamon tea so you get the full benefit and avoid any issues. First, as I mentioned earlier, do not use cassia cinnamon for daily consumption. The coumarin content is too high. Ceylon is what you want. If the package doesn't specify, it's almost certainly cassia. Look for labels that explicitly say Ceylon or true cinnamon. The sticks look different too. Ceylon sticks are thin, papery, with multiple delicate layers rolled together, almost like a cigar. Cassia sticks are thick, hard, single-rolled bark. Second, do not add sugar or honey to your cinnamon tea during this challenge. Adding sweetener defeats the purpose entirely. You'd be spiking your blood sugar with the very drink meant to stabilize it. If the taste is too plain, that squeeze of lemon I mentioned works beautifully. A thin slice of fresh ginger adds warmth and its own anti-inflammatory benefits. Third, if you are currently taking metformin, glipizide, or insulin, do not stop or reduce your medication based on this video. Cinnamon tea is a complement, not a replacement. Talk to your doctor. Bring this information to your next appointment. Most physicians, when presented with the research calmly and respectfully, are supportive of gentle dietary additions like this. Fourth, more is not better. Stick to 1 or 2 cups a day. Consuming excessive amounts of cinnamon, even Ceylon, can cause digestive discomfort, mouth sores, or interact with blood-thinning medications like warfarin. Moderation is the entire philosophy here. And fifth, consistency beats intensity. 1 cup every single morning for 30 days will do more for your pancreas than 5 cups today, followed by nothing for 2 weeks. Your body adapts to gentle, repeated signals. That's how lasting metabolic change happens. Not through force, but through rhythm. Let's bring this all together. Your pancreas has been working for you every single day of your life without asking for recognition or rest. After 60 years, 70, 80, it deserves some help. And the remarkable thing is that help doesn't have to come from an expensive prescription or a complicated regimen. Sometimes it comes from a $3 bag of Ceylon cinnamon, a kettle of hot water, and 10 quiet minutes in the morning before the world starts making noise. Over these 7 days, here's what you've layered in: a morning cinnamon tea that improves insulin sensitivity and reduces pancreatic workload, a short walk after breakfast that pulls glucose from your bloodstream using nothing but your own muscles, an evening cup that primes your system before dinner, a simple sugar audit that opens your eyes without overwhelming your willpower, better hydration that thins your blood and eases metabolic processing, a 2-minute breathing practice that lowers the cortisol your pancreas has been fighting against for years. None of these changes are dramatic on their own. Together, stacked across 7 days, they form a foundation you can build on for months and years to come. I hear from viewers every single week who tell me they tried something small from one of these videos, stuck with it, and 3 months later their doctor raised an eyebrow at the improvement in their lab work. That's not magic. That's consistency. That's showing up for yourself 1 cup of tea at a time. You've spent your whole life taking care of other people, your children, your spouse, your parents, your colleagues, your community. This is you taking care of yourself, and you deserve every sip. If this video helped you today, or if you think it might help someone you love, I'm going to ask you 3 small things. First, hit that subscribe button and tap the bell so you never miss a new video. We post senior health content every single week, and something here might be exactly what you or your family needs to hear. Second, share this video. Text it to your sister, email it to your neighbor, post it in your church group chat. You never know who's quietly struggling with blood sugar and feeling overwhelmed by all the conflicting information out there. Third, drop a comment below. Tell me if you're going to try this 7-day challenge. Tell me about your experience with blood sugar, what's worked for you, what hasn't. This community learns from each other, and your story matters. Thank you for spending this time with me today. Take good care of that pancreas. It's been taking care of you longer than you know. I'll see you in the next one.